Thank you so much for that kind introduction and inviting me here today to amplify the ASHP conference theme, Leadership in Higher Education and Healthcare in a Post-COVID World. My name is Tory Cenaj, founder and publisher of Partners in Digital Health. The topic for discussion this afternoon is New Era Methods and Market Relevance in Scientific Dissemination. Our agenda today includes emerging medtech markets, telehealth and blockchain issues and opportunities, the role and impact of social media in scientific communications, and I have a case study. Let's begin with emerging medtech markets. On the screen is the Partners in Digital Health mission. The portfolio presents both opportunity for you and your universities, as our initiatives are in new emerging markets, both niches in healthcare, blockchain, and telehealth. As publisher, I like work that demonstrates not only novel research, but research that makes an impact, most particularly the financial impact on the industry, workflows, and patient care. The question is how technology and innovation can be used to curtail costs in healthcare and make it more affordable for patients and those in need. My horizon line ends with patients. We also encourage sharing failures and negative research. Negative results are held in high esteem at Partners in Digital Health. In fact, we awarded the first Best Article Award to a $50 million startup that went bankrupt that we published in Telehealth and Medicine Today. Our motto is one we take seriously: building trust through truth. You'll find we walk our talk. Blockchain in healthcare today is the world's... Can you forward the slide, please? My clicker isn't working. Yes, thank you. Blockchain in healthcare today is the world's first peer-reviewed journal that amplifies and disseminates distributed ledger technology, research and innovations in healthcare, information systems, clinical computing, and network technologies. Editors-in-chief are Bill Buchanan, professor at Edinburgh Napier University in the United Kingdom, and John Halamka, president of the Mayo Clinic platform. The table includes reader affiliations. The journal is read in over 70 countries, has over 200,000 viewer engagements. It's more like 220 now, actually. I need to update that, and is highly cited for a new journal. Telehealth and Medicine Today is a gold international open access peer-reviewed journal examining the value of telehealth in clinical automation, its use and scalable developments, along with business process guidance in an evolving technology sector. Editors-in-chief are Lyle Berkowitz, professor of medicine at Northwestern University, Amar Gupta, IMES and CSAIL at MIT professor, and John Halamka, again, president of the Mayo Clinic platform. The journals are on Alexa and include blogs, technical briefs, traditional scientific research, along with video abstracts and podcasts. I invite you to submit to these two new market gems. Journals are indexed in Science Open, Index Copernicus, Unpaywalled, Nebis, Google Scholar, and the PKP Project Metadata Harvester. Let's take a look at what we do that's different. In my experience, when you bring a new journal to the market, you need two things: a unique raison d'etre, not being a Me Too journal. And as a publisher, I ask myself, what am I bringing to the party beyond readership, citations, credibility, conformity, enhancing the author's reputation, research, and validating content? Because we're a boutique and small, not legacy publisher, we remain hands-on with the community, highly customer-focused, work with you, advise, and consult, and nothing goes into a black hole for months and years. I'm happy to report authors have actually pulled submissions from other journals and have submitted them to ours because we're present, responsive, and appreciative. This is the beauty of being new, independent, nimble, flexible, leading change in the industry, and on a team that's truly passionate about what they do, impact, and bring to a global healthcare system. I make it a point to reach out to emerging nations for diversity and to be inclusive. The TMT Article Award this year is from an author from Bangladesh. It has actually nearly 30 citations to date, believe it or not, and we just published it last year. But let's take a look at these unique features. CONV2X Symposium is a leading annual health tech transformation and modernization symposium hosted by the journals. This is where we announce our best article awards. And the awards are granted to a high consequence article selected by editors-in-chief based on total views, downloads, and citations. We look for market engagement and impact. The new APOO, the Article Proof of Origin, uses the Hedera hashlog data timestamping service to protect author and research content. Hashlog data stamping uses the Hedera public network, and the network is climate friendly and leaves a low to no carbon footprint. And I share this with you because I'm asked about it all the time. Artifacts is the first life science research portal for authors and global communities, registering original research article provenance on the blockchain, creating a permanent public record for the scientific community. We do accept digital currency, payments, for example, Bitcoin. I think most of you by now are familiar with this new word. The Partners in Digital Health Institute was launched earlier this year and includes a speakers bureau. We receive many invitations to speak, and I typically pass these to our editorial board members as a thank you for their voluntary service for the journal. There is also a new initiative we're working on for a new business model incorporating digital currency to enhance reproducibility and sharing of research that's published. We also have license editions in the Mideast, extending our reach by 46,000 in the Mideast region alone. Finally, we also publish retractions and corrections on the blockchain, although we haven't had to as yet, but it is certainly there and available, and we can and will. Can you go to the next slide, please? Trouble again with the clicker? Perfect, thank you. This is a sampling of the member organizations we belong to. Altmetric is actually an important one and comes up again and again throughout the presentation. It measures social media impact conversations and exchanges. And the BHTY journal, for example, Blockchain in Healthcare Today, is highly cited, and even the lowest cited articles provide 5 times more exposure in the field than other journals as reported by Dimensions. Other initiatives we implement in the portfolio are direct community outreach to thousands of community members around the world. Blog submissions are encouraged and there's no charge for them. We encourage e-prints and distribution by authors. We publish press releases for landmark research, and the Telehealth Impact Study is one example, published in the July issue of Telehealth in Medicine Today. We offer a university APC rate in addition to waivers, LinkedIn posts, Twitter, Facebook, Medium, YouTube, SlideShare, Stitcher, Spotify, Substack, podcasts, videos, and special issues are all leveraged as appropriate. The PDH portfolio tries to be everywhere. Site badges are featured on article landing pages to help researchers better discover and evaluate scientific research. Code Ocean extends the scope of article software code through a cloud-based computational platform. Dora, we are pending members there. We have Science Open collections for both of the journals. Like it or not, science needs to go social because that's where politics, the media, and the funding bags have placed it. The ivory tower is just coming to terms with this, and those of us leaning into the future are already on board maximizing across many of these platforms to share truth in innovation and science. There are two schools of thought. One is old and one is new. The new school wants and encourages and looks for and certainly appreciates the extended reach and penetration into and across social media, and this includes open access, especially those using public grant funding. For the most part, researchers don't have thousands of followers, time to post and attract followers, don't develop campaigns and graphics. This, in fact, takes more time, money, talent, communications, and expertise than researchers, labs, universities, and NGOs have. It is not a predatory practice. For me, launching a new portfolio in two evolving new health era and tech sectors, the social media aspect was and is important to develop, offer, enhance, promote, and to appropriate audiences to attract more attention, more manuscript submissions, and expand reach faster. Of course, there are those that absolutely will not consider the journals without being indexed and having an impact factor. This view reflects the currently legacy system of promotion and tenure that many are trying to change. And stay tuned because we'll come back to this point of discussion later in the presentation. Enhancing Biblio diversity, and this can be done through social media and digital marketing. Here, I want to bring your attention to the red type in this slide. Diversity in services and platforms and evaluation measures will allow the research communications to accommodate different languages, publication outputs, and research topics, and pluralism of different research communities. We'll see this in our case study later. Incidentally, the NIH has a page dedicated to tips for social media dissemination. And again, these are not predatory practices, but a must for credible science and innovation dissemination in our world today. Let's look at future trends and hot topics in the industry. Where are we heading and what should we consider for global health consumers? Our portfolio both reflects and sets trends in innovation in the marketplace. These trends and hot topics are where I personally believe we are heading. First up is zero knowledge proofs and federated learning. In September, the White House released an Office of Management and Budget draft for federal strategy to move us into a zero trust architecture. This will enhance security across federal agencies, but industry more generally is adopting this strategy and posture. It follows the executive order on improving the nation's cybersecurity. If you've been hacked recently, you understand the urgency. The metaverse, A fully realized digital world with 3D virtual spaces creating perceived virtual holographic universe experiences. And this would include digital twins, a virtual representation or simulation that operates in a real-time digital counterpart of the physical. It takes a while to wrap your head around that one, but it's very, very exciting indeed. So just keep an eye out for developments there. Remote patient monitoring, managing care in real time, including scheduling and drug adherence. CMS is amplifying telehealth and RPM with new CPT codes, the inclusion of new remote therapeutic monitoring codes in 2022. The physician fee schedule signals the transformation of digital health policy initiated in response to COVID-19 will have some permanence. Here. Diversity and inclusion presents new market opportunity and discovery for clinical trials, startups, apps, payment models, cross-border collaborations, market investment, and more. COVID has taught us there are significant differences, and using data collected from white males only does not inform population health. There are sexual, cultural, age, and geographic diversities, among others, to consider. Cash economy in healthcare, and forgive me, I completely forgot to insert a big $sign in this slide, but this is a reliance on current payment mechanisms that will continue to lead to delaying of care, poor outcomes, and frankly, bankruptcy for the middle and lower classes here in the United States. Now, employers have already begun to give their employees cash instead of health insurance. It's what I call a retail health revolution, and includes new business models of care where consumers pay cash for drugs and services that are cheaper than those covered through insurance. Hims and Hers, for example, is a company, a startup, that uses this cash-based model very successfully. And last on the slide here, we do have home health market expansion. You'll hear much about this at ConV2X in November, from health policy, the gaps and opportunities, infrastructure, and consumer preferences. Needless to say, it's where PE and VC money is going, so do follow the pot of money. And price transparency is a hot potato, but someone has to champion. So here I am. The January 1 CMS rule required most private health plans, group health plans, and individual health insurance market plans to disclose pricing, making hospital pricing information transparent for patients to compare costs of their care. It required hospitals to post negotiated rates and display pricing for over 300 items and services. However, only 5.6% of hospitals have been compliant, when over 85% of Americans believe cost-cutting and improving quality by making price more transparent should be a priority for lawmakers. Along those lines, site-neutral payments, again, CMS using site-neutral payments to level the playing field between what physician offices and hospital outpatient departments are paid for clinical visits. Health Savers Initiative, this is the Committee for a Responsible Federal Budget. Arnold Ventures and West Health released a report that finds implementing site-neutral payments would save $350 billion, billion, that's B, yes, $1 billion over the next decade. And so we should look for more policy, regulation, and government here. We might also see capitated risk-based models in the near future. Continuing along, what's hot? Ambient AI, no, not the company Ambient AI, but literally Ambient AI, real-time human perception technology enabling intelligent environments. This is where physical environments interact intelligently with people, where technology can anticipate and respond to people's needs, customize and forecast behaviors. Then we have cryptography, which is more or less uncrackable code, encryption, if you will, and quantum encryption. So applying principles of quantum mechanics to encrypt messages in a way that is never read by anyone outside of the intended recipient. Then we have global health passes and interoperable permissioned global networks. Blockchain will improve how the public interacts with government and services and will have broad economic and social implications. NFTs, non-fungible tokens, providing proof of authenticity, including ID and account holder to verify the owner of an object and objects that can be sold. And finally, the hands are a catch-all visual for low-cost, fast, secure data interoperability and healthcare for all. 12 states still have not expanded Medicaid. And well, just overall, what a fun world we're creating at the moment. So let's go to the next slide. Thank you. So this brings me to where publishers are headed in the current scientific research conversation vis-a-vis technology. So machine learning is the first, where we have the potential to change how publishers and aggregators organize content for their readers and delivery. We can create groupings of related content, making recommendations to readers, connecting research to scholars and publishers, finding peer reviewers for manuscripts, and analyzing article citations to see if they're positive or negative. STM suggests AI can make publishing and research faster, more reliable, and enhance its quality and integrity. Tools for trust and transparency can be applied to better support the dissemination of all research outputs, and this is where blockchain can add value along with provenance, security, contracts, and consent. Interoperable metadata is machine-readable metadata and content standards to make metadata more accessible, reliable, and reusable with consistent file structures among parties in the supply chain. Metadata describing the content can impact discovery, sales, or usability of a particular file, which I find very helpful being on the publishing side, along with shared data mapping, standards, and expectations. There are, as you know, new OA open access publishing models and standards. Plan S is a consortium to make research fully and immediately open access, including author self-archiving and article transaction models. We at Partners in Digital Health Institute also have an initiative along with an incubator for startups and students that we are working on. Alternative research assessment methods, the journal impact factor driving the current research assessment culture has had an identity crisis. The suggestion now is research should be assessed on its own merit rather than the journal in which it's published. If that were true, I wouldn't be chasing impact factors and you wouldn't be asking me for them. Many groups argue that focusing on journal brands intensifies competition between researchers and journals in ways that distort behavior and undermine a healthy and productive scholarly enterprise. This too is from Dora. As we know, a journal impact factor is a poor predictor of the number of citations a paper receives. Our own BHTY journal is a perfect example of this. It has no JIF, journal impact factor, yet, but it does have an inordinate number of citations. Shifting the emphasis from journal to article is really highly desirable. Now, the culture of hiring, promotion, and grants must change, and for this, we must engage with organizations and adopt change. This is slowly occurring, but I encourage you all to find acceptable outcomes that can be quickly adopted by all. Plan S calls for changes to the publishing incentive system to support the development of open access journals and curb corporate control, meaning legacy publishers, over the majority of high impact titles. I signed on to this initiative as a small OA publisher, but I really haven't experienced any impact, either positive or negative, beside witnessing sky-high APC fees on the legacy publishing side. I believe we do need more scientific and research integrity from Asia, and this includes more rigorous methods and depth for our peer review on the publishing side. Preprints are on the rise, but the integrity of these papers is a challenge, and I do believe the source of papers should determine the level of triage and depth of vetting in peer review. Language diversity, cultural pluralism, and bibliodiversity are also priorities to see and encourage more published research and global research sharing from emerging markets. And again, these are my own perspectives that I am sharing with you at this time. So let's continue on. The role of impact of social media and scientific communications. Let's look at a few headlines first to gauge what some of the issues and gaps in scientific dissemination are at present. So the first here is the volume of published research is stymieing the pace and quality of published research. This article states that the size of scientific fields, well, I think we want to go back one. Here we go. The article states that the size of scientific fields may impede the rise of new ideas. Examining 1.8 billion citations among 90 million papers across 241 subjects. When the number of papers published per year in a scientific field grows large, citations flow to already well-cited papers. New papers are unlikely to become highly cited and unlikely to disrupt existing work. This suggests progress of large scientific fields may be slowed. What we should expect is policy measures to shift how scientific work is produced, disseminated, consumed, and rewarded to push fields into new, more fertile areas of study. This is exactly what we experienced when we launched BHTY. We created that niche and provided the credibility and validity for it to grow and flourish as a new and credible field in science and technology for healthcare. Now let's go to the next slide. Oh, vanishing bias already. So this article takes a look at gender, career, and stage, as well as geography. So the corrections reported here are the Epsilon Index. This new Epsilon Index is a new way to reduce systemic biases in assessing researcher quality via citations by providing career stage, gender, and opportunity corrections to citation-based performance metrics, specifically engineered to ensure gender balance. The next one. This article espouses true innovation and creativity versus publishing in top-tier journals for profit and productivity. Many truly novel innovations are going to second-tier journals or specialized journals with smaller reader exposure, missing the opportunity of being read, studied, and applied by more researchers. I do see this occur, but I don't necessarily agree that smaller reader audience exposure follows. It depends on where your research is published, and that's really what you have to look at. So there are pros and cons to this one. The next and last one, I believe, is replication. Here, the author presents the impact of negative results and non-replicable research. The article quotes Glenn Bagley, stating, in the US, sloppy science costs $28 billion a year, so there's a lot of lost opportunity. But the advances we've made are incredible, and there is an innovation opportunity to give money to innovative scientists to keep the US at the forefront of discovery and innovation. This is a hot topic of late, with all the spigots open and flowing for grant opportunities. Now, with regard to social media impact, to put this in perspective, if you input social media and academic journals in Google Scholar, you'll get over 3 million papers. And I've highlighted a few of my favorites on this slide. Promote your journal using social media, editor resources, and this is from Taylor Francis. This is a quote straight from the site. Social media is an amazing tool for journal editors. Editors are already using Facebook, Twitter, or LinkedIn to create online communities for their journals. This in turn is providing them with an ideal platform to raise the profile of their journal and in turn promote the content. Now, again, we focus on the journal and not necessarily the article, whereas we at Partners in Digital Health, yes, we promote the journal, I must, but I promote articles specifically and repeatedly. Now, they've created what they call a social media guide specifically for editors to support and guide you. So this includes learning how to market your journal, using social media, and keeping it as their go-to guide to build community. And they also suggest 7 simple steps for a successful approach to social media. One is know your target audience, choose the right social platform, build your community, create a content plan, and write compelling posts. Now, this may be great for editors or journal staff, but it's not optimal for authors in the least. And this is also suggested for authors and researchers. So the next article, using social media to promote academic research, identifying the benefits of Twitter. Now, what I find very, very interesting here is that it's garnered over 17,000 views, over 400 shares, and it's cited 28 times. So the apparent interest of this article alone is quite telltale. So the conclusion states, Twitter offers scholars the opportunity to push their research rather than depending on other people to pull it from academic publications. Across all scholars, we find evidence that pushing research on Twitter is correlated with greater citation counts. Given gender disparities in other forms of academic research dissemination, we consider whether the same gender disparities exist on Twitter. Tracking newly published papers across journals with a wide range of impact factors, we find no evidence that more women authors on an article decrease Twitter sharing. Further, we don't see additional gender disparities between tweets and article citations. Well, that's good to know. The next one, social media impact in media, a new method to evaluate social research. This I found astounding. Over 100,000 views, over 100 shares, and 58 citations. Mind you, this article is a PLOS article, and so is the other one I just mentioned. So the social impact of research is an increasing concern here for the scientific community, and they suggest it's critical to advance the methodologies and approaches to measuring the social impact of research. And their conclusions are: 1, evidence of social impact, both potential and real, in social media enables sharing and improvements generated by research and opens up new venues for citizens to interact with work. Conclusion 2, with the increasing relevance and presence of the dissemination of research, results indicate that scientists need to include dissemination and communication strategies of social impact of their results. And 3, social impact in social media facilitates access to citizens of different ages, genders, cultures, backgrounds, and education levels. Citizen contributions to the dissemination of evidence yields more diverse sectors of society and information that might be unknown to the researcher. My favorite one is the last one. Publication is not enough. To generate impact, you need to campaign. I shared this myself across media outlets and with every journal board member and ambassador member because I thought it was spot on and described exactly what we do at Partners in Digital Health. Again, being a new journal portfolio, we work harder to impact the global health marketplace. Article content includes great advice, including demonstrating the impact of research outside academia has become a standard requirement for many research funders. The author advises to achieve impact, engagement has to become a central feature of academic routines. He quotes Emerald Publishers' Martin Lawrence from 2011, actually, writing, "Invisible research is by definition low impact." Funders are now looking for return on research investments. The Ford Foundation expects grantees to achieve the greatest possible impact. EU Horizon 2020 proof of concept applicants must outline the economic and/or societal impact expected from projects, and the UK's REF assessment gives a 25% weighting to the reach and significance of impact. So he goes on to tell us about the World Bank publisher who was about to publish a report on AIDS in Africa, and the World Bank wanted to use the report to draw attention to what was then a growing problem and raise money to help address it. And someone presented the report to Bill Gates, who pledged $5 billion to fight AIDS in Africa. So what is the cause and effect here? One report to the right audience caused action, which to him, the author, equates to impact. So this diagram shows the steps from discovery to action and the relationship between knowledge and information in this process. Persuading someone to take action requires creativity, and I would also add persistence and repetition. He suggests adding graphics. Naturally, humans are visual and 80% more likely to read a text when it has an image. After reaching an audience, authors should develop their network to build campaigns that raise awareness, stimulate debate, and convince others to get on board and advocate for change. The author references altmetric. Our journals use altmetric. He tells us his articles have an altmetric score in the top 5% of all research outputs. Our articles do too. And as a result, he's received invitations to speak at conferences and write blog posts and develop his audience to make an impact. I mentioned earlier, we do the same, and our board members get offers too, so this formula works. For those of you launching and leaving your research in print and online, your efforts are not working. Let's look at a case study. Okay, this is a case study that was published in Pain Medicine. It's an Oxford University Press journal. I posted the social media metrics for a 5-month campaign for a period between October 2019 and February 2020 for an online repository of scientific literature, including material on prevalence and under-assessment of pain in dementia and guidelines for clinical management. The hashtag See Pain More Clearly garnered over 5 million Twitter impressions, representing a hashtag reach of over 2 million. Unique users who had either interacted with the hashtag, meaning tweeted or retweeted messages containing the hashtag. Moreover, almost 3,000 posts were shared during this period, with 578 individuals, 86.9% of whom were female, 75% were retweets, 16% were original tweets, and just over 8% were replied tweets. In terms of user location, the hashtag was used in 31 countries, with 20% of the interactions occurring in countries outside of Canada. This team of authors and collaborators were located within Canada. 68% of the hashtag users were from mobile phones engaging with or on Twitter. And among the 10 media stories that covered the initiative, 5 were recorded interviews and 5 were written. So the tweets were subjected to a qualitative analysis with the hashtag, and 6 themes emerged. One was information and resources, expressions of support, advocacy for better care, opinions and commentary, personal experiences, and the last was other. Now, this is a fantastic example of the impact and reach a good campaign can have. It's well worth a read if you get the chance. As an aside, Oxford University Press, the publisher of Pain Management, has a LinkedIn, Twitter, YouTube, and Facebook account. I couldn't find anything more there. But the moral of this story is that no one is too busy, too talented, or too innovative not to promote, market, educate, communicate, and engage with social media audiences far and beyond those of your colleagues and networks. Until and when academic tenure and promotion requirements are changed, social media is and will be a certain method for proving, demonstrating, sharing, and gaining more exposure, more citations, understanding, adoption, use, and sharing of novel research, articles, and publications. Just this morning, I actually received, it was an email from Simpler, because I didn't include them in the presentation, so I'm telling you about it now. But Simpler is a product, and that's spelled SYMPLUR. Simpler is a product that services the voices in healthcare And they are the creators of the Healthcare Social Graph, the world's largest database of public healthcare conversations and influences. They have a healthcare hashtag project, and they just added a new hashtag for clinical investigators. Along those lines, they also have a new study just published or recently published in JMIR, evaluating scholars' impact and influence, cross-sectional study of the correlation between novel social media-based scores and the author-level citation metric. Do engage with them if you can and track them. It will be well worth your time and effort. So we're almost drawing to a near close here. Next slide. Yes. In closing, would like to wrap it up for new era methods and market relevance for technology and scientific dissemination. I do want to leave you all with a complimentary link to our annual symposium, Converge to Accelerate, where you will find outstanding agenda and world experts and influencers over 3 days covering health policy, telehealth, and blockchain research in healthcare. Thank you all so very much for joining me today. It's been my pleasure speaking, and I do hope you found the content useful and motivates an exploration into how your work can be shared in creative and non-traditional ways. Thanks to ASAHP, the team there, and a shout out to Dr. Butler, who turned the tables on me and invited me to speak here today. Thanks so very much.